to Taboo Malta. It's a show that discusses taboo topics in the sunny island of Malta. So today we've got Dr. Chiara Frendo Balzan for part two. We're happy to have her.
I'm happy to be here. Thank you, Sophie.
Thank you for coming again.
Thanks.
So today we're going to start out with talking about appointments at the gynae. So if someone comes in and they're a bit worried or concerned and they don't want to undress, what would you tell them? What happens?
I mean, obviously, it's a consultation, and there needs to be some kind of emotional intelligence involved, right? Every patient is different. So the professional will need to read the patient, how they're feeling, and also it is very important that the patient is comfortable in what they're doing. Okay, so when I can tell you what I do when I see someone who I perceive as being anxious, and this is quite common. Someone going to the gynecologist feeling anxious. It's almost
Expected.
exactly the theme that someone is going to walk through the door and they're very anxious. But if it's not assumed, I will state it that everything here is done by consent. Okay, so whatever you're going to do, you're going to consent for, all right? Whether it's implied or signed. Normally you have signed consent forms for procedures. But it's important that consent is a vital part of everything, right? If you're not comfortable with doing something, then it's a no, and that thing is not done. Whether it's talking about something, whether it's undressing, okay? And I state this implicitly, that if I'm going to examine you and you're not comfortable with a part of the examination, please tell me so we can stop. Okay, so if you want me to stop, you say so and we stop. And I've had patients who come in for the first time, and maybe they just were only comfortable with the conversation or the consultation, and then I would explain what the next part would involve, like an examination and the ultrasound scan, for example, and what the ultrasound scan is, whether it's an internal ultrasound scan, because that sometimes can surprise people as well.
Yes.
Like, oh, it's going inside me. Yes, that's
Especially once you've calmed down after the smear test and like, oh, I'm going for an ultrasound, and they present this.
yes, this massive probe. And yes, it is scary when you look at it, because it's like, 12, 13 inches of stick. But I hold it in my hand and I say, listen, that much is going to go in. A vagina is 10 centimeters. Okay. Yes, it is stretchy, but it's 10 centimeters. So that part is going to go in, and the rest is a handle for me to hold on the outside. So it's not that scary. But again, going back to your original question, if someone does not want to undress, nobody can force them to. Okay. So if you don't want to undress, if you only want to speak about something, state it. And it's okay to state it. Right? Okay, I am not ready for an examination today, but I would like to discuss some things with you. And that's absolutely fine. That's absolutely fine. I think every professional would happily accept that. There's nothing wrong with that, is there?
You can just book another appointment, basically.
Indeed.
If
Absolutely.
it frees up, why not?
Absolutely.
And can someone get checked for a smear test if they're on their period, for example, or have a yeast infection? Like, how would it go?
Okay, excellent. I'm so glad you asked this question, because it seems that there is some misunderstanding with smear tests. Just for our listeners, smear test is a screening tool. It checks for early signs of cancer in the cells of the cervix of the neck of the womb. Okay, so the procedure is by putting a speculum inside the vagina, so the professional looks at the cervix and takes the most superficial layer of those cells. Okay, it's like a little exfoliation, like scraping. Okay, and that then is prepared into a medium or a slide, and that is looked at under the microscope by the pathologist in the lab. So, if someone is on their period and there is blood, there's going to be blood cells. And if we do this kind of procedure, there's going to be extra cells, and the pathologist under the microscope cannot read the original test. Okay, so the cells that we're looking for at the smear test, okay, the cervical cells, are less visible because there's the blood cells. Okay, and then that makes it an invalid test. So it's very important that someone is completely off their period and not bleeding. Okay. With the yeast infection, thrush candida, okay, call it what you will, this kind of fungus will irritate the vaginal mucosa, okay, the skin of the vagina. Because the fungus has got like roots, okay, it will infiltrate these cells and make them appear inflamed. Okay. Every woman or a vagina owner knows that if there is a yeast infection or a fungal infection, candida, it's so irritating. You feel like you need to like scratch yourself from the inside into yourself, right? So imagine what that is doing to your cells. Right, okay. So the pathologist at the lab, looking under the microscope, these cells are going to look abnormal. They're going to look inflamed. Going back to the original smear test, the smear test is looking for abnormal cells because abnormal cells one day could potentially lead to cancer. And abnormal cells are inflamed cells. So is this inflammation because of a yeast infection or because of the HPV, the virus, the human papillomavirus that we know is implied in a lot of cervical cancers? And obviously then that test is going to be not invalid because obviously there is inflammation, but it needs to be repeated. So ideally, the smear test is done when someone is completely well without any symptoms. Sometimes we do occasionally find the little fungal hyphae, the cells of the fungus, because you don't have any symptoms. But that's okay. You know, I'm not pretending that everyone who comes in needs to be completely well and symptom free, because people who are not well will come in. But that is the professional to decide, listen, okay, I'm not able to do a smear test today. We will need to wait and then we'll do it again. Because a repeat test, we need to wait 3 months. Because, yes, absolutely. When we remove those cells, they need to grow back.
Okay.
Because there's nothing to test for if you come back next week. Okay, so we need to. It's a decision to be done. Like, okay, I cannot do it today because otherwise I'll have to wait 3 months. So let's give you treatment, and then come back next week or 2 weeks time, and then we'll do it. So that also is efficient in timing, if that makes sense. I hope I've answered this question.
Yes. Very, very interesting and very good to know.
There's a lot of thought process that
lot.
goes behind all of this.
And can you tell through a smear test if someone has polycystic ovaries, for example, if they're not getting their period and they have the layers lining up, would that affect the smear test at all or no?
The layers lining up?
Of the uterus. So, for example, you wouldn't shed the lining.
Okay.
And then
okay, absolutely. Okay.
It would be thicker.
So, smear test is the test for cervical cancer. Okay. It's a test that is done in the lab. It's looking at the neck of the womb. It's not looking at the ovaries.
Okay.
Okay. So the ovaries are higher up. Okay. So we got the neck of the womb, and then we got the womb, the uterus, and then we got the ovaries. So when we do a gynecological assessment, we have all these aspects. Yeah, we got the ovaries, we got the tubes, we got the uterus, we got the neck of the uterus, we got the vagina, we got the vulva. So these are all different parts of the human anatomy. With polycystic ovaries, the way to assess polycystic ovaries, to look at them, is with ultrasound. Okay, best way to do a gynae ultrasound is a transvaginal scan, like we were talking earlier, because it gets closer to where we need to look at. And then we look at the appearance of the ovaries on the screen. And the polycystic ovaries, there's a typical appearance. So polycystic means poly, a lot, yeah, multi. Cystic, cysts. And these are tiny fluid-filled bubbles. When we see these, there could be a hormonal imbalance because they produce hormones in an erratic way that would lead to irregular cycles. So it is very possible that the patient would have cycles that are 35 days long, 40, sometimes even 60, sometimes going back to 30. And that's okay. It's not bad. If there's a period, it's good. What is very important is that lining that you said, okay? So the lining is thickened, but needs to be shed. And through research and statistics, it has been shown that the safety limit is 3 months. So it's important that you have a period every 3 months. So this needs to be shed, cleaned out if you want, okay, every 3 months. Anything longer than that, these cells within the lining start changing, start becoming abnormal, and could lead to, in the long run, to uterine cancer. Okay, so that's why there's a safety limit of 3 months. The way to regulate a cycle artificially is by taking hormones, by taking the pill. Okay, either the combined pill where it gives a cycle and the lining is shed because it does have estrogen, so that causes thickened lining, you withdraw, and then you have a fake period. Or the progesterone, which keeps the lining nice and thin, and most of the time patients who are taking these type of contraception with progesterone do not have periods. Sometimes they have irregular periods. Okay, so this taking hormones also protects that lining. I also appreciate that there could be that patient who does not want to take hormones, and that's absolutely fine as long as there is a period of 3 months or every 3 months. And that is very important. So we need to educate the public that if you don't have a period for 4 months, then speak to your doctor because something needs to be done. Yeah.
And it's also not good to go on a Premier Lute, right? Like every single time, like what happened to me, basically.
Primulets.
Yes.
Okay. So, I mean, that is one way to get your period. Okay. So, if a period doesn't happen after 3 months, but I would wait 3 months. If it's 2 months, it's fine because it might come, right? But yeah, Primulet is the type of progesterone, it's the brand name for progesterone, where we stimulate the bleed. After you withdraw, you stop it, yeah? 2 or 3 days later, you get a period. But that's one way. That's one way. There are the supplements that can help the ovaries kick in their own cycle. Something like chromium or L-carnitine. There's ways and means, but this is how we assess. Yeah, polycystic ovaries needs to be assessed by ultrasound scan, and not actually through a smear test.
Okay, yeah, there was a bit of confusion around that, to be honest. And with PCOS, there's the syndrome where you can get the physical parts of it. So, for example, some people have reported to be hairier.
Yes.
That it's harder to lose weight, for example. So it affects a number of things.
Absolutely.
What advice would you give those kind of people who are trying really hard, but due to hormonal imbalance, it just keeps on reoccurring?
So PCOS is one of those things that's quite controversial, and there's a lot on social media, Instagram, TikTok, and there's various different types of PCOS, and the S part is the syndrome, okay, and it's a metabolic condition. So it's not one thing. It's not like saying Sophie has green eyes. Okay, it's a few things altogether, and it's how the body functions. And one thing that's particular with PCOS is the insulin resistance. So there is insulin that is being produced, but it cannot be utilized properly by the body. Okay, so in that manner, the body functions as if it is diabetic. Okay, because there is a carbohydrate metabolism problem because the insulin is not being used. Okay, so we see that these women who are taking a lot of carbohydrate and eating a lot of carbohydrates, they tend to put on weight because they're not being burnt off, and then they put on weight, even though carbohydrate is fat free, right? Okay. So going back to carbohydrate metabolism, if that person reduces their amount of carbohydrate intake or uses or takes low GI diet, Okay, I don't want to go radical as keto, but keto also is helpful. Okay, there's even more radical diets than that, like the carnivore diet
Yes, what do you think of that? Because the lion diet,
and
right?
the lion diet.
Because some
Indeed.
people say it really balances their hormones, but
So yes,
I'm not
but
sure.
everyone is different. Okay, so there is this gut microbiome that's like a fingerprint. Every single person is different, and the way people metabolize vegetables could be different. So I cannot say, vegetables are healthy if for that one person it causes them to have allergies, for example, or abdominal pain. And this all goes back to the gut microbiome. But going back to your PCOS, the PCOS, your question, the with PCOS, because the syndrome has different traits. Okay, so you mentioned excessive hair, so this is called hirsutism medically. Facial hair in a male pattern. We target that. Okay, so we use hair removal products, laser. So the way I try and deal with PCOS, there's a lot of counseling involved. Okay, the patient needs to know what is happening. It's their body. I cannot say, "Oh, you've got PCOS and this is your prescription," because if that person does not understand how their body works, that prescription is going to be left in their bag. But knowing that there is a carbohydrate metabolism problem, that there is insulin resistant, that there is possibility of developing diabetes in the future, then that would help that person change their lifestyle. We know that insulin resistance is also related to obesity. So the more obese the person is, the higher the insulin resistance. Insulin resistance improves if that person loses weight. And this is a very, very big topic. It's a touchy topic because if you tell that person, I need to lose weight, just like that, without explaining why and how to lose weight. Because if they try, like their friends, to cut out chocolate for Lent, that's not going to help much because they need to change their whole diet. It's not a low-fat diet that they need to follow. It's a low-carb diet.
It's a holistic lifestyle change.
It's a complete holistic lifestyle, and movement will help as well because that will help increase metabolism. But with PCOS, I tend to target the symptoms, okay, or the signs. So if the symptom is excessive facial hair, then advise about laser or hair removal. If it is period problems, we talk about, as we said, listen how to regulate with hormones or without. If it's obesity, it's the trick to lose weight, yeah? So it's targeting what the problem is. If that person is trying to get pregnant and they have irregular cycles, it's trickier. It doesn't mean they cannot get pregnant. I cannot tell someone, oh, you can't get pregnant because you got PCOS, because that person won't be using contraception and then gets pregnant when they're not planning to.
Or
So
gets STIs, basically, yes. Because the pill does not prevent STIs. We're going to repeat again.
Exactly.
Yes.
I think we said that last time.
Yes,
And I
I'd
thought
like to
exactly.
drive the point home, though. Yes.
Absolutely. And in fact, statistics do say that taking the pill increases your risk of STIs. But it's not because they're connected, it's because of the habits of that pill user. Yeah, so it's important. New relationships, always use condoms until you do an STI screen. But yes, PCOS is one of those topics. It is holistic. It's
Yes.
another part of PCOS that people don't talk about is the self-image.
Yes.
And there's a lot of psychological aspects that go with PCOS because self-image is distorted in PCOS. So what you see in the mirror is not real. And yes, absolutely. You see yourself bigger, you see yourself frumpier one day, and then the next day you feel like, oh, I look awesome today. But that doesn't make sense because when you go to work, you see your colleague, you don't see them one day like, oh my goodness, you don't look right today. You look ugly. You look really bloated and fat, and the next day you look so good. But in the mirror, as a PCOS patient, there's this distorted self-image, and we don't talk about this. In other countries, there's some CBT and psychology input with PCOS.
What is CBT?
CBT is cognitive behavior therapy.
Ah, okay.
So get a psychologist involved. Here in our country, Malta, we sunny Malta, like you said in the introduction. PCOS is very common, is very prevalent, and it seems to, we say genetic, but maybe because it's so common. In other countries, like I remember that my perception of PCOS when I was in the UK and here, very different. Absolutely. I used to see girls hiding their faces. Yes. Hair like this against their face, so they don't show their face, wearing big jackets, so because of excessive hair. And I've not seen that in Malta, so that's a positive. That's good. Yeah, it's embracing that. Yes, the PCOS patient most of the time looks different. Yeah, roundier, but yeah. But there's nothing wrong with that. Looking at yourself in the mirror, there's nothing wrong with that. Quite interesting, PCOS.
Mm-hmm. Oh, for sure. I think we also need to deal with the body dysmorphia and the mental side of it, like you're saying, and seeing ourselves as normal. Open quotes, yeah.
Normal. I love that word, normal.
Yeah. In fact, there's a lot of people that say, like, what are normal breasts? What are normal vaginas or vulvas? And this was in the show Sex Education, in fact.
Uh-huh.
Yeah, I don't know if
Yes.
you watched it.
No, I haven't.
Okay.
No, not yet. No.
Basically, they did cupcakes with different vaginas on them because they think that a lot of
Alright.
people question whether their body looks normal because of porn most of the time, and that's
Yes.
what leads to
Yes.
body dysmorphia and surgeries to get themselves
Yes.
looking perfect.
Yes.
And
Yes.
yeah.
This is big. Huh? This is big. We don't tend to talk about the negative. We boast about good stuff, but the negative, or what we perceive as negative, we shy away and we don't seek help.
Mm-hmm.
And I've seen young girls who have come to clinic, and young girls, I mean teenagers, and they're exploring their body, and porn is easily accessible nowadays. And they don't realize that their body is actually perfect because of a perception or a belief. Okay? There's nothing wrong with having larger labia. Why do you want to trim them? If there's an irritation, if there was stitching done that is causing issues, I get that, right? But to trim labia that are perfectly symmetrical, perfectly normal, yeah, there's no need, because vulvas come in all different shapes and sizes. And just like men are not symmetrical, we're human.
Yeah.
We're not born with plastic surgery. Even plastic surgery can be botched sometimes. But many women have different sized breasts. One side maybe looking further south than the other. But there's nothing wrong with that. We don't need to be absolutely perfect, because perfect doesn't exist.
Mm-hmm. Mm-hmm.
Yeah. Vulvas will still function if they have small labias, if they have bigger labias. It doesn't really matter, as long as there's no irritation and catching on underwear. That could be an issue. I have rarely seen. So I've seen a lot of vulvas, and there's the vulva wall. I don't know if you're familiar with that. So there's this art piece. I don't know who had done it, and it's like plaster casts.
Ah, yes.
Of all the different vulvas, and some with piercings, and it showcases that, listen, there's the variety and there's the beauty in variety. And some men would prefer bigger labia, some men don't like bigger labia, and porn is like that as well. So there's the variety. There's nothing wrong with what we've got. Yeah.
I think we just have to accept what we've got. And
Love it.
also love if somebody doesn't like it, that's not our problem either. Like we shouldn't be
Exactly.
modifying ourselves for someone else.
Because once we start chasing that, then where do you stop?
Exactly. It's
Where do you
never
stop?
ending.
If you trim your labia and then you break up with that person, and the next person like will mention randomly something about bigger labia, and then you've trimmed yours. I mean,
Yeah, for sure. For sure. I think we need more education on porn in general, I think, especially in schools, and how to deal with body dysmorphia and all these things. Like it's mostly with females. I don't know the actual statistic if it's the percentage in males, for example, but I think it's a huge issue, especially with social media at the moment.
of course, which is all fake.
Mm-hmm.
Which is all fake.
It's all
What they
fabricated.
show us is not real.
In fact, there's a stereotype on social media with PMS and how we become this angry monster. There's a lot of series, in fact, depicting PMS or getting your period as an actual monster.
Absolutely. Yeah.
But now there are celebrities with actual coming out that they've got this. I forgot exactly what it's called. It's like PMS, but more in the long term. It's more drawn out, and it affects the way their body dysmorphia, their relationships, and the way they communicate. I'm not sure if we can talk about that a bit.
Okay. So PMS is premenstrual syndrome. Yeah. The symptoms one feels in that time between ovulation and the period. We have a cycle, and there's a surge of hormones just after ovulation. Yeah, when the egg comes off, and there's that ovulation releases luteinizing hormone and then progesterone. So these hormones spike every month. That is what a cycle is. There's a spike and a trough, right? And some women are more sensitive to that hormone. And with PMS, symptoms do vary. Some people are more irritable, more teary. Some people have rage. Some people will want to eat more things that they don't normally eat. People have brain fog and they can't focus. So people have headaches. There's different symptoms that one would feel. And if there is a pattern that is noticed, so we would advise to keep a calendar to see, is it cyclical, right? Because that helps us with the diagnosis. Because if it's not cyclical, if it's happening during all of the month, then it's not going to be PMS, because that goes against the definition itself, right? A severe form or more severe form of PMS is the premenstrual depressive disorder, PMDD. Okay. In that case, we would need medical treatment because the person would find it unable to cope with life, basically with activity of daily living, with going to work, with being social with their family or their friends. So then, in that case, medication would be highly recommended. Two medical ways to treat or to help cope with these premenstrual symptoms. One is either to stabilize the cycle by taking a hormone. Okay, so something like the hormonal pill, because it gives you a dose every day that is stable. It removes the spikes. Okay, so in that manner, then one does not have PMS because the hormone level is stable during the whole month. Okay, and then you stop the pill. You have that 7-day break or 4-day break, and then you have a period. And if someone does that back to back, then they reduce the number of periods they have in the whole year. Okay, instead of every month, maybe every 2 or 3 months. So that's one way, and that's hormonal. The other medical way is by taking an SSRI, which is a selective serotonin reuptake inhibitor, a type of antidepressant. It does not mean that the person is depressed, but it stabilizes the, if you want, happy hormones in the brain. So it stabilizes your reaction to these spike of hormones. So that's two medical ways. Okay. Obviously, if there's PMDD, then discussion with the psychiatrist needs to be had, and further treatment, exploring probably more antidepressants. Not in my realm of things. There's also alternative therapies, acknowledging what is happening in your body. Again, going back CBT, knowing that, oh, okay, I've got my period next week, and that's why I'm feeling like this. It's okay. Certain herbs, certain vitamins, evening primrose. There's a lot of even up and coming research about all of this, and actually what PMS is, and why we've got PMS, and this is all being explored nowadays, and it's fascinating. But then going back to the patient, it's helping that person feel able to cope.
It's sort of one size fits all. Basically, depends
Never.
on a case by case basis on what
Yes.
you're going through. And like you said, there shouldn't be any taboo against SSRIs if they're needed, because if you've got an imbalance, you need to balance it out.
Correct.
Basically, yes.
We cannot forget that the brain is an organ. Why do we isolate the brain? Why is it different? If you got a problem with your teeth, you go to a dentist, right? And you fix that. If you got imbalance in the brain, you go and fix that. But there's a taboo. Why?
I think it's the act of taking a pill, but as females, we're so used to taking pills that that specific pill isn't allowed, so
Yeah.
it's a funny thing. And when talking about periods, so there are some organic tampons and pads, and then there's a menstrual cups. Like, are some better than the other? Because I know that you can get TSS, toxic shock syndrome, with tampons if they're left in too long. But there were whole studies that they've been bleached and they're not that
Absolutely.
good. And
Yes.
so what are your views on this?
Yes. Well, again, this is super interesting, isn't it? I like your topic, Sophie. I do like your topics. Toxic shock syndrome. I've never seen one, and I've seen people who have left tampons in, and I've seen actually someone who forgot the tampon. So when she came for her coil, I'm like, what's this? And it was her tampon from the previous month. Absolutely, I know. So it's not like, oh, I think I couldn't take it out. She literally forgot that she left a tampon there without even knowing, right? And in that case, she didn't even have toxic shock syndrome. I think in the past, there was more. I don't know. Maybe the manufacturing style has changed. Tampons are one of those things that. There's plastic involved as well. You need to be environmentally conscious. Organic is very good if someone is irritated by tampons. Okay, so maybe you need to explain to your listeners as well about toxic shock syndrome. Toxic shock syndrome is an infection where the tampon is left inside the vagina for so long that there's bacteria that starts growing on this nice bed of blood and cotton. Okay, and then that infection can go even into a blood sepsis. Okay, antibiotics is the treatment for this because it's bacteria. I don't think there are people who actually leave their tampons in long enough for this to happen. I think that mentality of, listen, tampon maximum 8 hours or overnight, and you don't leave it for longer than that. Tampon manufacturing has changed. There's lots of organic now. The bleaching of cotton, obviously, there's chemicals in everything. There's chemicals in everything. Organic type of these sanitary products will help those who tend to get infections or irritations. There's also probiotic infused tampons. Yes, there is one brand on the market here, and they have probiotics. So for that person who struggles with thrush infections after the period, that could be a good idea. Going back to your question about silicone cups, it depends on the material, and if you're allergic to the material, I don't find anything wrong with the cup. Okay, it's more environmentally friendly. Obviously, careful when you rinse it out, and you need to clean it properly in between periods. Some people boil it. If you're not irritated, if it's done well, okay, from a good source, all right, so the material is reliable, then there's nothing wrong with that. If you're not reacting to that material, there's nothing wrong with that. Yeah, there are organic pads. There's pads that have a layer of plastic and more absorbent material that could be more irritating to the vulval skin. So everyone is different. It depends on what you are comfortable with.
Okay. And talking about periods, so there's obviously the whole conversation about menopause and HRT and when periods actually stop. And not a lot of people talk about that either. And you can get early onset menopause, right? So it could happen at a younger age. I guess it's more rare.
It can. Yes, 1% of women go through early menopause, premature menopause. And you don't know when that's going to happen. It's most of the times associated with other autoimmune disorders. So it's like the body's fighting itself, and then these women do have cessation of periods earlier. Menopause is a natural process, but it's a scary one. The time of the perimenopause, so the time around the peri means around the menopause, is about 10 years. So it can be up to 10 years. And naturally, the levels of hormones will start decreasing. Still within the normal values, but they will start decreasing. And you feel this, right? You start feeling it. And they could be brain fog, they could be irritability, they could be an inability to sleep at night because you get these hot flashes that are like seconds, like this flash in Maltese vampa. Yeah? So it goes within seconds, vroom, all over. It starts from your feet up to your head, and you just get like in a sweat. Yeah. But then it's over in seconds. But this is really bothersome. It's if you're at work and you get these, and you're in an office and you can't get out, and so the perimenopausal woman does get more frustrated because of these symptoms. It is yet a natural process, but it's the weirdest feeling because you all of a sudden you have no hormones, no estrogen, you have dryness, you don't feel the same. You have lack of libido, you're not attracted to your partner, you feel like, what is wrong? What's going on with me? And these women are young, so 50 is not an old age. Still a sexually active woman, but she's having issues. There's the urine problems as well, with incontinence and urgency. And we don't talk about the negative. So if someone's at work and they need to take a lot of breaks, like what's wrong with that? What's wrong with that employee? And that could be frowned upon. But yes, menopause is a natural stage that we cannot escape. We will have to go through menopause at some point. But there are things that we can do to support the female hormones. There's natural supplements, there is HRT, hormone replacement therapy, lifestyle changes, caffeine and spicy stuff will also obviously will not help those symptoms of palpitations and hot flashes. We would focus more on antioxidants. Soya, okay, so soya is it's a bit of a controversial topic because we know it's genetically modified, but it also is estrogenic, so it gives estrogen symptoms. So it's both ways. I'm not saying either party is wrong, because there's people who will argue both sides. But we know that soya, isoflavones, these also help those women who don't want to take HRT in the form of the synthetic hormones. And that also means that people who are breast cancer sufferers, they should avoid these soya products as well because of the estrogen, because breast cancer is related to estrogen.
Some people even say, though, that HRT might cause cancer. Is that true? I've heard this before.
So HRT is hormones. Estrogen, some cancers thrive on estrogen.
Okay.
So if you are taking estrogen and you have a cell that just wants estrogen to just bloom and grow, it's going to grow, and you're going to end up having an estrogen-dependent cancer. That's why. That's why.
And with menopause, it could be brought along with hysterectomies, for example, that you might have too many cysts or fibroids. So can we discuss how important it is to get checked, and if you're feeling like you're 6 months pregnant and you've ballooned up and you don't know why and you're getting pain?
Yes. So with any symptom that is not normal, please, you need to get checked. Okay, so we need to inform your listeners, your viewers, that if you have a symptom that you're not comfortable, if you're worried about something, please do get checked. Okay. Hysterectomy is surgical removal of the uterus. Removing the uterus for fibroid reasons, heavy periods because of fibroid.
Can we explain what fibroids are?
Fibroids is a knot of muscle. Okay, so it's super common. About 25% of women, approximately, have a fibroid. Okay, so fibroids are these knot of muscles within the uterus, most of the time within the uterus, and that gives symptoms of heavy periods or pressure pain, depending on how big the fibroid is. The ultimate treatment for fibroids is removal of the uterus. Okay, so that's the definitive treatment. There is other treatments one can explore, but that's the definitive treatment. Once you remove the uterus surgically, you are not going to have the fibroids, you're not going to have periods. We don't always remove the ovaries. Okay, so under the age of 45, it's not advised to remove the ovaries unless, obviously, if they look normal, you leave them there. Because if you remove the ovaries early, you're going to have surgical menopause. Okay, so surgical menopause means menopause that is brought about by surgery, is because of removal of ovaries, because those are what give us the cycle, the hormones. Okay, it's not by the hysterectomy, so it is not brought by the hysterectomy. Yeah, so a menopause is not the uterus, but it's the ovaries. I have confused you here.
No, it's very informational, to be honest. Yeah, there's a bit of confusion.
It's the what words we use as well. So hysterectomy is removal of the uterus. It does not do anything to your cycle. It does not do anything to your hormones. It only stops your periods. So if someone who is, let's say, 38, okay, problem with a big fibroid, heavy periods, we surgically remove her uterus, hysterectomy, the ovaries are still there. She will still feel a cycle. She will feel it. She won't have a period.
So where would the eggs go?
They just get lost.
Esther, okay.
Absolutely. So she could still have PMS. She's not in menopause. Okay. She has her own hormones. That's why we don't remove the ovaries before 45. Okay? Because we don't want that young woman to go into menopause at a young age and then have the repercussions of menopause, something like osteoporosis, for example, brittle bone disease. But over the age of 45, so someone who's 48, 49, who's going to be going into menopause, statistically, average is 51, then we would also remove the ovaries. Removing the ovaries gives you surgical menopause and also removes or reduces the risk of ovarian cancer. Now, let me tell you why I'm trying to choose the word. Because it is still not 0%. But obviously, having no ovaries, the risk of having ovarian cancer is going to be almost zero. Okay, but with ovarian cancer, if there's other cells that are inside the belly, cancer can be from any abnormal cell, unfortunately. Yeah, so if you have any symptoms, any strange feelings in your belly, bloated, please do speak up.
Thank you. Okay, and our last question, so a bit controversial. How do you feel about the whole abortion discussion in Malta and what's been going on? And if I'm not mistaken, if a woman's life is at risk and she's pregnant, it was already the case, right, that they terminate the pregnancy. So now there's a whole discussion of whether they're going to introduce it or not, if it
Yeah.
should.
Yes, yes. So, I mean, we can talk about this for hours on end. It depends on which aspect you're going to look at it from, okay? Whether it's the medical aspect, whether it's the legal aspect, whether it's the ethical aspect, the social aspect, okay? Because all of these, so far, have not come to a agreement. It obviously there's a political aspect as well. Ultimately, it's the politicians who are going to decide on this. So what the proposal was to remove the act of crime. Okay, so in the law, it is a crime if someone does carry out an abortion on themselves, or if someone helps someone else get an abortion. Okay, so that is a crime. The amendment that was proposed is to remove this from being an actual crime. Okay, and this would help the doctors at the hospital. If someone comes in who is 20 weeks, who has the heartbeat is still there, but they've broken their waters, and after a discussion with the woman, we know that the prognosis is not going to be the best. If she proceeds and with the pregnancy and she wants to keep the pregnancy, knowing full well that the prognosis isn't going to be great for that, as far as we know, for that that fetus, that baby, that's fine. But it also helps the doctors, give them that okay, to make a decision that, listen, we're going to prioritize the female, the woman's health here. And we don't need to be listening in to the heartbeat. And if the woman decides, take care of me first over the fetus, then it doesn't become a crime. So that is what the amendment was being proposed. What is not being proposed is until what gestation age. We already know that if someone comes in with an ectopic pregnancy, that is non-viable. We'd always choose the woman's life over that heartbeat in the tube. So it is, and other people would argue that this is the first step to allowing abortion to be available in the country for everyone, and there will be abuse. I've worked in a country where abortion was legal. It's never nice for that person to decide what they want to do. Nobody wants to kill their own baby. And if they go through an abortion, trust me, the psychological impact is not one to be taken lightly. Especially in Malta, where it feels like you cannot speak out openly about this. Okay. And in my experience, those women who sought an abortion were the ones who either were using contraception and it failed, or something was wrong with the development of the fetus. So it was, if it was unexpected in the way of rape, for example. Many people who are sexually active and not very careful with contraception will absolutely willingly welcome that pregnancy. It's mostly in those times where it's really hard for that woman, that couple, to proceed with the pregnancy. We cannot hide behind the fact that in Malta these things do happen. Many women do seek help. They go abroad. They seek medical help to then do an abortion at home. So, are we going to put all of these women in jail? Are we forgetting about the woman? So, we need to. It's a very controversial topic. Killing of a life. So the ethical aspect of the religious is, you're stopping a life, you're killing a life. But we're also forgetting the parents' point of view. If someone is not ready to take care of a child with severe disability, who am I to judge? I'm not going to judge them. Yeah, I cannot know what that person is going through. Maybe it's a blessing for them. Maybe they are enjoying. I don't know if it's the correct word I'm using actually. This sacrifice for them. Okay, but it's not for everyone. And just like divorce is not for everyone, it doesn't mean if I agree to divorce, I want to get divorced. But yeah, it's a tough topic, this one.
Going back to, just because you don't agree with it or believe in it doesn't mean you should not give someone the choice to do it, which I think is a huge issue in Malta, that we impose our beliefs on others. So like you said, whether it's divorce, abortion, euthanasia, you might personally not agree with it, but at least give someone the choice to do it, That's a democracy at the end of the day, no?
Yes. Oh, absolutely, absolutely. And I also think that we need to have more contraceptive options and contraception being more freely available.
It's free in France, I heard
Many
recently.
places is subsidized.
From 18 to 24, though. Yeah. For us so far, I think it's the HPV and cervical cancer injections that are free from 12 to 15.
Yes.
Because in my time it wasn't.
But that's not a contraception.
That's not.
No.
Yeah. It's the only thing that's free in this subject. I can
Yes.
think of, yeah.
Yes,
Yeah.
I think so.
Uh-huh.
Yes. And obviously smear tests, we can have those on the government system.
Yeah. Just have to wait a bit. Yeah.
Many, it's sadly it's when we talk about abortion and we put our views out there, and we don't know what that person is going through. It could be that your own daughter, your niece, probably has had an abortion. So we need to be also careful what we say.
And the reality is, we'd rather that they have a safe abortion,
absolutely,
rather than an illegal one at home or abroad where their life might be at risk,
Illegal and criminal, it's it's illegal to park on the double yellow lines. It's not a crime. We're talking about a crime here. So at least that is what the amendment is. It's not, let's make abortion freely available for everyone and let's set up clinics, and we've got a long way to go, I think. Yeah.
Thanks. Do you have any final comments?
No, I'm always grateful. Thank you for allowing me to disseminate a bit of education as well. This last topic might have been a bit controversial. Maybe we'll get different views, and I always welcome different views because it helps me see another side of things, maybe that I hadn't seen before. So yes, but maybe you can tell your listeners, your viewers, that it's okay to speak up. Yeah, with your consultation. Okay to refuse things. It is okay.
Thank you so much.
You're welcome. You're welcome, Sophie.
Thanks everyone for watching. I'll post the details of Dr. Chiara Frendo Balzan below if you'd like to make an appointment with her. In the meantime, if you have any taboo subjects you'd like to discuss on her, please get in touch. Thank you.